Oh, Audrey, yes.
Hey,
Glad you made it.
welcome, Audrey, and everyone else. I'm William Eckert, the Potsdam Public Library Adult Program Coordinator, here with David Bradford. He is a certified navigator with the New York State Office of Health for the St. Lawrence Health Initiative, and he's going to talk to us about affordable insurance, how you can get it, how everybody is available for it, and how there's no cost to apply to find out what your eligibility is, and some of the changes that have been made during the course of COVID-19 and how it has made it even more affordable and more available to everybody that is out there. Hi, David.
Hello, William.
Thank you for joining us. Thank you for holding this. And why don't you tell us at first, I think you and I talked about this. We talk about a target audience, people when they look at it.
Yes. So I know you're recording this. We may have some people just watching the stream on Facebook. And I am going to be using some slide deck from the state, New York State of Health Marketplace. Those of you in the grant world probably know that assures it is approved. But the audience, for those that want to know if they should invest their time or look for this recording later, is almost anybody. So clearly uninsured New Yorkers, what are your options going through the New York State of Health Marketplace, and specifically as a navigator, that's what I do. I am certified by the state to help people submit their applications through the marketplace. And we'll talk about the history of that and its connection to the Affordable Care Act, Obamacare. But more than that, almost anybody, I think, might find some interesting information because of the pandemic. There's been a lot of changes. For instance, I can work with people over the phone now. It used to be we had to work face to face. But even if in the past you've looked at the numbers or you were told you had to take your employer's insurance, with the passage of here recently of the America Cares Act, there has been they've made the system better. Those that are eligible are your eligibility now. You're not expected to pay now more than 8.5% of gross income for health insurance. It used to be almost 10%. Again, these are for higher income people. Of course, lower income people, the Medicaid is still out there. I definitely want to make a big push for, there's really no reason for people to not get their kids insured. Even if you're a little bit higher income, there's this thing called Child Health Plus, where what you end up paying, again, it will depend on your income, but we have many people that have their own employer-based insurance, but they find it unaffordable to put the family on, to put the kids on, and they do go through the marketplace to get health insurance for the kids through something called Child Health Plus. So we definitely want to talk about that. And then the biggest change with the most current signing of the America Cares Act impacts people, again, now a little bit higher income, where their subsidy for health insurance comes by way of a tax credit at the end of the year on their federal tax form. You go through the marketplace, you can have the New York State pay that anticipated credit up front to bring your insurance premiums down from day one, and that's gotten a lot better here just within the last month. So if people thought they checked into it a month or two ago and didn't think it was affordable, they need to check again. And if you have insurance, if you do have insurance through the marketplace right now, a qualified health plan, the tax credit has gone up, and you can go back, call your navigator, call the marketplace, and we'll talk about how to different options to go through the marketplace. It doesn't have to be through me as a navigator. You do want to check on that to see about adjusting and getting 100% of that anticipated credit, get it up front. There's no reason not to, and then you settle up at the end of the year. So yeah, we'll have some information for just about anybody.
David, and this is something else that I want everybody to know is that if we're going to have a Q&A with David at the end of the presentation. He has some slides that he'll talk to us and give us some more details about what's available, how you can find out what is available and what works best for you. And it's also recorded and will be reposted again later on for later viewing if there's any follow-up questions.
Okay.
And information will be made available. Contact information will be made available to anyone and everyone who wants to talk with David or has any follow-up questions for me and wants to reach him. David, why don't you give us a little bit of background on the marketplace? This is something.
Okay, yeah, you want to? I'll go ahead and use some slides now if you want to.
Yeah, that'd be great. And take it away.
Okay, now I actually noticed something strange. Let's see, I hope this is going to work. If I turn this into a slideshow, can you guys still see that?
Yeah.
Yeah, I wasn't sure. I've got dual screens and I wasn't sure what it was going to look like for you. Okay, so basically I'm going to use a presentation that I've stolen a lot of, again, to make sure these are approved content from the marketplace, because I am a certified navigator, certified by the state to help people apply for health insurance through the marketplace. So I'll give credit here to Kelvin, who created most of these slides. I have added some information specific to here, for instance. So I am, again, I work for St. Lawrence County Health Initiative, specifically as a 100% navigator. Went down to the state or New York City for my training. Going to be doing it almost 2 years now, coming this summer. We have the grant. The point being that I don't work for an insurance company. This is the outreach of an extension of outreach of the state to try to help people get insured. And so when you work with a navigator, or you call the marketplace or whatever, remember these people do not represent an insurance company. They don't have a profit margin to get you enrolled in one program or the other. It's to help find out what's best for you, and going through the marketplace is how you find out what subsidies are available to you. The head of our program, Jerome James, is our program director, and there's now, gosh, I guess in the office we got up to like 5 people. I'm the point person for adults. We do have Lucy Colby, who's a point person for families that have kids that we want to get enrolled. Contact information there. Again, it'll be in the video, and we'll come back to that at the end to make sure people have contact information. So the things I want to be sure to talk about, like I said, we'll do some background just so you know what this is all about. And then basically after doing a chronological background, then we can step through the plans that you can get access through the marketplace. And these are the subsidized plans. So of course, low income, we have Medicaid. In New York State, they found that there was at the beginning of the Affordable Care Act back in 2013, there was something of another donut hole. There was this income level where people were just not finding insurance, a little bit above, the Medicaid cutoff, even after New York State expanded Medicaid, that was still not affordable. And we have something called the Essential Plan we'll want to talk about. If you're now, and then mixed in there is this thing called Child Health Plus, specifically for, and again, when we say children, so we're up to age 19, you can get your children enrolled in this thing called Child Health Plus. And then at a higher income level, something called qualified health plans. They look more like traditional insurance you might be familiar with deductibles and things. But again, the Affordable Care Act puts some limits, and we'll talk about that. And then with COVID-19, this open enrollment and definitions of special enrollment, that's got a little mixed up, and so we'll clarify that. And then, like I said, we'll want to be sure to talk about the different ways people can maneuver through the marketplace. I'm not a gatekeeper. You don't have to use a navigator, but again, why not? I cost you nothing, and it doesn't have to be me as a navigator. There's navigators around the state working for different nonprofits, et cetera. There is something of a strange thing where some insurance companies also have certified navigators, and I've never quite figured out how they avoid a conflict of interest there. They're supposed to, but anyway. And then, of course, we definitely want to hit on the impact of that recently passed America Cares Act, this stimulus bill that just got signed last month. Mainly, it is impacting the affordability for the higher earners that are up into what are called the qualified health plans, and we'll want to specifically talk about that. But I'll work my way up to that, partly just so I'm in step with these slides, even though this is where there's a lot of changes within the last month. But let's back up chronologically. Did I skip one? No. So basically, the history of the Affordable Care Act, back in 2013 is when Obamacare first was instituted. States were offered federal dollars if they would expand Medicaid. Many states did not. There's some tangents there. Don't get me started on Missouri, my home state. It's an embarrassment, like all I can say. Don't get me there. But New York did take the federal dollars way back at the beginning, expanded Medicaid. They created their own marketplace. Some states use the federal marketplace. If you accidentally go to the federal marketplace, as soon as it finds out that you are a New York resident, they'll send you right back to the New York State marketplace. So it is designed as a one-stop shopping for subsidized and unsubsidized. So you can get higher earners if there is no tax credit for you. You can still use the marketplace to find and enroll in insurance as well at what would be called full pay. Some people have done it, so they have compared prices through the marketplace and through a broker, a more traditional insurance broker, and found the prices are competitive. In fact, that was a lot of the rationale behind the Affordable Care Act, is to give more competition to the insurance companies to then bring down insurance prices for everyone. And in fact, you find that you find now that employers are offering plans that are more in line with costs to their employees, more in line with what you would find through the marketplace, again, because of the pressure of the marketplace to bring down those costs for everybody. There are tools within the marketplace to help. So if you're one of those higher earners, even with the tax credit, you will have some choices to be made between insurance companies. But again, my services are free. If you call the marketplace, you can actually do it over the phone with the market and someone right there at the marketplace as well. And again, these are people that do not represent an insurance company, but are helping you find out what plans are available to you. To get a financial subsidy, you have to go through the marketplace. In other words, if you are going to be Medicaid eligible, you got to go through the marketplace to get that eligibility, to get enrolled. Essential plan, likewise, is a medical plan. You got to go through the marketplace. If you're going to be using a federal tax credit, if you want the marketplace, and why not, to pay that credit up front before waiting to the end of the year to file your federal taxes to get that credit, you got to go through the marketplace. So there's really no reason not to do that. And when you get your eligibility, it will be income dependent. So you don't get to choose. So you say, well, okay, I'm low income. I could enroll in Medicaid, but I've heard bad things or whatever, and I want to pay more to get a qualified health plan. You don't have that option. Your eligibility is going to be dependent on your income. And so this is specific for New York State residents. And that actually does include some visitors, such as international students on F1 student visas could actually go through the marketplace as well. But you do have to be a New York resident. If you leave the state, then yeah, you change your official residence, your permanent residence. You are going to have to check out what's going on and wherever you move. If you are just leaving the state temporarily, we have people that go away for like a summer job or something. No, you are still a permanent New York resident. And so just the same things happen with your insurance as would happen with any insurance policy. If you're out of state, well, no, you wouldn't schedule your annual physical with a doctor out of state. You would wait till you came back to state. But if an emergency and you end up in an emergency room, no, you would have the same emergency room coverage as you would with any insurance policy if you were out traveling.
David, if
Yeah.
we live in an area where there are multiple colleges, so we have a lot of students, some that stay here for longer periods of time, are students long-term students that take up residence here? Is that something they're eligible for as well?
Yeah, so again, they would need to define, specifically say that, now my permanent residence is New York State. There actually is an added benefit for students where even they can actually be still claimed on their parents' tax forms, but if they are independent, they are now living independently on a school campus. They stay on campus, for instance, over the summer. So they have changed their permanent residence. They're no longer living with their parents. They can go through the marketplace and get their eligibility determined just on their income and not considered part of their parents' household within their parents' income would also need to be part of the application. Even as their parents still can claim them as on their tax forms. So that's important for students to know, yes. Thanks for that question.
Thanks.
So like I said, I got something for everybody here. the whole gamut up to age 64. So that's the last one there. So let me share again. So the, all right, did I do it right again? So up to age 64. So as soon as you turn 65, you age out. You should be then talking, actually before your birthday, talk to your local Office of the Aging. Every county has one to get a true, a smooth transition into Medicare. But so 65 and above, you will not go through the marketplace. You'll go through a different way to get Medicare coverage. All right, so to finish up then our little overview, historical overview to get started. So, so this is early, so about a year ago, through the marketplace, we've got 4.9 million New Yorkers now enrolled. Hopefully that number has gone up with the pandemic. I can say specifically in St. Lawrence County, we're somewhere, actually somewhere near the average uninsurance rate. But but it's still above 4%. So there's still above, I forgot the exact number, over 4% uninsured still in St. Lawrence County. So there's still more to be done. I don't know what the numbers are. So if anybody, like we've been asked to promote our services out into like Lewis County and Franklin County here as well. So if anybody's looks at this or is watching the stream right now, I'm not sure what your statistics are in Franklin County and St. Lawrence, or Lewis County, but I would guess it's probably comparable. Something over 4% uninsured still in our region. And definitely with children, again, there's a big push to try to bring that number down as low as we can. Well, for everybody, but then especially children. So again, New York jumped on right at the beginning in 2013. Yep. So let's talk now specifically about plans. So these are, whether you're talking Medicaid Essential Plan, the Qualified Health Plans, these are full range, insurance plans. It's not a Skippy or whatever. A part of the Affordable Care Act was actually to define a basic, what do we mean by a qualified health plan? It has to have a certain minimum basic coverage. And so it is going to have, first of all, a list of preventative care. So no matter what insurance you get, there's now a list of essential services that you need to get to keep yourself healthy. The idea being keep people out of emergency rooms for their health care. So again, whether you're talking Medicaid, Essential Plan, the Qualified Health Plans, all have these essential services that you get right up front. And they're full range, your inpatient care, your outpatient, special services for mothers and newborns. Like I said, the emergency service, you got to have your lab, and so it is full range. All plans will have pediatric dental and vision. There are now, for adult vision, there are differences. Medicaid is a plan that includes vision and dental. When you go to Essential Plan, the Qualified Health Plans, you may have to pay more, be a little bit more careful about looking at plans if you are interested in getting adult dental or vision care. So let's start at that low income level. So you have, again, Medicaid. It's based on the federal poverty level. That number has just gone up. They've adjusted the federal poverty level here. It went into effect this month. For a single person, I actually have a chart here. The chart of values is a little out of date. I apologize. I understand that this is maybe not easy to read. But I'm showing this card. So this is the kind of card we would actually, back when we met with people in person before the pandemic, we would have one of these we could hand people. I have a digital copy now, so I can get these cards to people. On the back side, we have the specifics in terms of who is eligible for them. Again, this is out of date. This is 2019, just for the PowerPoint. Of course, we would get a new one with the new income levels, which, like I said, have just actually gone up. Not a lot, but they've gone up a little bit just this month with the new 2021 federal poverty levels. In other words, the percentages are still the same. In other words, up to 138% of the federal poverty level for a single individual, there is going to be this income cutoff. And these are gross numbers. These are your annual taxable gross, defined the same way as it would be defined as you fill out your federal tax form. If you have a larger household, they'll cut up, those numbers go up. And to get children, again, you see it's a higher percentage of the federal poverty level to determine whether a child in your household is eligible for Medicaid or not. And again, don't stick your nose up at Medicaid. Don't forget that Medicaid includes vision and dental. So that's an important thing to remember.
David, is there a place where folks can find the updated numbers? If they see this, they can come back and look at this again. Like this will be a video that people can come back and use as a resource later on our webpage.
I have those in a separate email that just got sent to us. I can, you tell me the best way. I mean, people can contact me or.
Is there a website also where people can go and find some of that new updated information?
I'm sure there is. I don't know off the top of my head.
Okay.
So I'll, is there a way where you've put this recorded version, we could have links like that?
Yeah, you can, if you can get me the information where we have some updated information for folks to be able to find out what their eligibility is, and then we can send that and so that we can make it available to them, as well as your contact information, and then they can contact you if they have any further questions as well, and try to navigate that in order to be able to get themselves insured.
Actually, I guess I didn't feel too motivated to update that number, because the message I really want to push is my service as a navigator to apply through the marketplace is free, and you're not committed to anything, just to find out. And so what I want to encourage people to do is you don't have to figure this out all on your own with your own, Google searching or whatever. Run an application and find out, what your eligibility is, et cetera. Just there's really no reason just not to pursue it to find out, versus trying to figure it out all on your own ahead of time. Your research would probably take as much time as to actually just do the application. But yeah, we'll get those. I'll get that information to you.
Wonderful.
It's 1.5% or so more than these numbers, so it's not a big change. All right, next step up. So let's say you're above that cutoff for Medicaid, you're making a little bit too much. Again, New York State identified there were people that were still finding insurance unaffordable, so there's something called the Essential Plan. Very similar to the Medicaid. Same, it's a full service medical insurance. It includes those same essential services, that free preventative care. It is still a no deductible plan. There may be a $20 a month premium payment, and it would be per person. Let's say you're a couple, it'd be $20 for each of you. If you did want, and there may be some low co-payments that are a little bit more than a Medicaid plan, which might have none. For instance, the prescription drug coverage for Medicaid, it's $1 for a generic drug, $3 preferred brand drug, co-pays so that would go up to $6 for essential plan. There is no vision and dental immediately. If you are wanting to add a plan that has vision and dental, it's like you can get a plan that would cost an additional $23 a month to include vision and dental. And you'll want to look at that. You'll want to look to see whether that is, in your situation, worth it to you, or you're still thinking that you'll just pay out of pocket once a year for a dental checkup or something. But again, working with a navigator can help you make those kind of decisions. So let's again look at the essential plan. This sort of donut hole that the state of New York identified. Actually, this is showing more specifically what, in terms of some of the co-pays you might expect. Again, if you're just barely above the cutoff for Medicaid, you'll find that you still have zero co-pays. So basically, the only distinction between the Medicaid and the Essential Plan is going to be that you do not have automatically vision and dental. You'll notice the drug coverage co-pays are still exactly the same. If you're then a little bit higher, and I know you can't read that, it's $18,730. So again, that dollar amount might be a little bit higher. The percentage is basically it's 150% of the federal poverty level is where you make that transition where you would now have to pay $20 a month, and you would have some co-pays. And then for prescription drug coverage, you do have a little bit higher co-pays there in terms of $6, $15 for the preferred brand drug, and $30 for a non-preferred brand drug. And like I said, you can find plans that do include vision and dental if you were willing to pay. Again, it's something like $23 more a month now. All righty. So these numbers here on the right, again, are a little bit higher. But just to give you an idea of where, as a household of one, where you would end up, again, the point being in the marketplace, your income is going to determine your eligibility. You can't pick and choose. Your income will determine that, whether you're below that, and then specifically that's 138% of the federal poverty level, you're going to be Medicaid. Between that and 200% of the federal poverty level, you're in the essential plan. And somewhere in there, you may have a $0 premium or a little bit higher income, a $20 premium. But then when you go above 200%, you now are into what are called the qualified health plan with the tax credits. But before I talk about that, which again is where there's a lot of change because of the more money coming from the federal government now to help support better tax credits to help people afford health insurance at the higher income levels. That's where a lot of our uninsured still are, the people that are just finding it monthly premiums and the deductibles. They just say, well, this isn't worth it. But before I do that, I really want to hit on the Child Health Plus. Oh, okay, I forgot about this one. This will give you some idea of, depending on how your household size impacts these cutoff numbers. So yeah, if you're now a household of 4, yeah, you could be all the way up into $36,000 and still be Medicaid eligible. Now this would be everyone in that household. All of their gross incomes have to be considered as that household income. So again, big families, yeah, check it out. You may find there's affordable insurance out there that you just maybe were afraid didn't exist. Yes,
David,
the household side.
Making that segue, you're talking about folks that were, back to the audience being everybody, people who might not realize they're eligible, that can help them get better, more affordable health care. But you and I talked about this previously, and something that you were kind of segueing into was the fact that with this Child Health Plus, that whether or not you as an adult or a parent can afford insurance doesn't mean that your child shouldn't be covered, and that your child can be covered, and that this is something that's more than affordable and eligible to everybody.
Yeah, so the state has really bent over backwards to try to make insuring your children as affordable as possible. So again, like I said, by all means, people should apply, find out. There is no cost. So of course, if the whole family is Medicaid eligible, the children would be Medicaid. But let's say a household is making more, the parents may be on the essential plan. The children may still be Medicaid eligible. Remember, the children have a higher percentage of the household income cutoff for their Medicaid eligibility. So you could have parents that are essential plan, which could still be very affordable. Why would you still want your children on Medicaid? Don't forget you get the vision and dental. But let's even go to an extreme. Let's go up to higher earners. So you see here a family of 4. They can get, and this is a little misleading. Remember, anybody can go through the marketplace and get a qualified health plan. So a higher earner over for even this family of 4 of 104,000. Really what this implies is talking about whether or not you're going to get a tax credit at the end of the year. And if then the state of New York will determine what that tax credit should be and actually pay it up front to the insurance company to bring your premiums down. So and this number is going to go up, not only because of the increase in the federal poverty level this March, but more importantly, actually that new criteria doesn't go into effect until 2022 in terms of the change in the federal poverty level and where this cutoff is. But the America Cares Act is actually going to make it people that maybe a couple months ago you checked and there was no tax credit for you, there will be now, or you may find that there is with the signing of this new bill. But so I don't get too off track here, let's back up and let's just talk about someone who maybe their essential plan or they have employer-based insurance. So maybe they don't need anything, but they find it is unaffordable to add their children on their employer's insurance. It becomes very unaffordable. You are not required to do that. You are not required, even if you have your own employer-based insurance, to include the rest of your family onto that plan. And many of you, or many people already know it becomes very expensive to get a family plan or to add children. And going through the marketplace, though, you can define your household and say, nope, I don't need insurance. I have insurance through my employer, but I would like to see what is available for my children. And again, depending on your income, there are steps of what you would pay up. And again, it's up till under age 19. So the children will age out of this plan at when they turn 19. But again, it is full coverage insurance, but including prescription drugs, and hopefully everybody can see here, including dental and vision. So again, there's a lot of good things about Children Health Plus, including again the dental and vision. And I don't know if people have seen it, but there's been a lot of recent research, or actually some years now, it's been identified how critical dental care, for instance, is for your overall health. People that don't are not taking care of their teeth, especially children, will have long-lasting impacts on their health. So again, that's part of the motivation that the Child Health Plus includes then the dental and vision as well. Let's look at some numbers. So again, if you're a family of one, well, that's ridiculous. If you're a family of one, you don't have children. So I don't quite understand that. So, well, actually, I take it back. I guess there are emancipated minors. So that's, but let's ignore that. So a family of two, you and a child, let's say. So you may be up, let's say you're making $50,000 a year. You've got your own insurance. Well, you put your child on that insurance, it becomes unaffordable. So you want to not do that, go through the marketplace and you may be able to find, you only have to pay $30 to get Child Health Plus. This is a month. So very affordable. Again, remember, it includes vision and dental. So, I mean, your monthly payments could just about, over a year be the same you would have to pay out of pocket for a yearly, or I know through that period, the dentist may actually want you to do, twice yearly, every 6 month dental exams for your children. So again, these numbers have changed a little bit. These are 2019. So these numbers have gone up a little bit. The point to be made here, though, is that there is a graduated scale here on what you would have to pay for a Child Health Plus, but it is very affordable. It does max out. There is a full premium. So we actually also have people that have found that even if they make too much money where they get no tax credit at the end of the year, again, they can't afford to put their children on their employer-based insurance. They still find going through the marketplace and getting full pay Child Health Plus the best Now it would probably be over $200 a month if you were full pay Child Health Plus. But I can't give an exact number because now that full pay depends on the company. These are private companies that actually offer these plans through the marketplace. And so those exact dollar amounts depend on the insurance company. But there is a cap. Let's say, again, a big family, they actually cap that total amount that you would have to pay at three children. So again, big families with 4 and 5, again, another incentive to go through the marketplace, find out what's available, because they will, even for full pay, they will cap the total out of pocket that you have to pay to get all of your children enrolled in a Child Health Plus. All right, so I think I've covered that. Again, by all means, anybody, Audrey or Will, if you come up with any questions, by all means, just interrupt me here. Because we are now, yeah, go ahead.
I was gonna say, David, just so you know, we do have some people that are watching on, where this is streaming on Facebook Live as well. And we do have people that have been tuning in and watching theirs, and been checking the comments section, letting people know in the comments section there that if they had any questions, to feel free to drop any there if they don't want to join us on Zoom, and that there'll be a Q&A section after this, so that they can ask you any questions that they might have, and that it will be available for later viewing if those that are maybe at work or just popping out during their lunch break aren't able to stay for the whole thing, and that your email and contact information will be available at the end, and I'll have that posted as well. So if they have any questions after the fact, if they weren't able to remain online, can reach out to you.
Okay, very good. All right, so now we're up at our upper end of our income families. You can still get subsidized healthcare, but so this is over 200% of the federal poverty level. Again, what is considered the federal poverty level depends on household size. So the larger household, the higher that number goes. It is full service, it's full medical. Typically, it's only medical. Just this year, there are now more options in terms of finding a plan that includes adult dental, if you're interested, or there are also standalone dental that you can get. Going through the marketplace, though, you cannot get a dental plan without first having a medical. So if you don't have a medical, you can't come to the medical or the marketplace just to try to get a dental plan if you don't have a medical plan through the marketplace. These numbers, again, are actually, some of them are still the same. So in terms of the annual deductible, there are what are called standard plans. The companies that offer plans through the marketplace, so not only do these plans then have to be what are called qualified health plans. So this is where the federal, the original Obamacare, it set a standard, a minimum standard that any plan had to meet, which included offering this whole list of essential services, the preventative care that is free. Well, it doesn't mean free, it means it comes with your premium payment. So you get this outside of any deductible. But this is more like traditional insurance, where the lower premiums you pay, the higher deductible. So the bronze would be the cheapest plans, but then they're going to have the higher deductible. That $4,700 is the current deductible for, again, a standard plan. The standard is where, to be on the marketplace, New York State says any company, they have to offer standard plans that have the same out-of-pocket expense, which includes both the annual deductible and then another feature of the Affordable Care Act, a maximum out-of-pocket. There is a cap above which now you're 100% covered, so people don't go bankrupt with their health emergencies. Again, this is per annum, and I mispronounced, per year. These plans, again, reset every year. Likewise, just as your deductible would reset every year. That is the same as more traditional insurance people may be familiar with. But to be sure I get the important thing in here, so again, I can get this card to people. These numbers are pretty much still accurate currently. These have not changed. There are non-standard plans at the marketplace where these copay amounts can change, so you do have to be careful if you look at non-standard plans. For a lot of people, the drug coverage is important. Diabetics, we've all heard about the outrageous costs of medicines that people need just to stay healthy every month. You got to be careful with a bronze plan in that typically almost universally, you don't get the drug coverage until you pay this deductible of $4,700, and then you get your generic $10, preferred brand $35, non-preferred brand $70. So you got to be careful there. So people that have expensive prescription drugs, maintenance medications they need every month typically have to step up to a silver. But again, this is a good thing, again, to work with a navigator where they can help you navigate if you're up here at the qualified health plan end of the scale. Now, you don't have to go through a navigator. You can try to use the web resource, the marketplace. It supposedly was designed for people to do for themselves. But again, many people have trouble. It's not as straightforward as the marketplace would hope. And that's why they contract with nonprofits like the St. Lawrence County Health Initiative and certified navigators like myself to help people. And I would actually run this application for people right from the same web page as if I was you, as I'm talking with you, but then the account would still belong with you. But let's, actually, so there's a button here called Compare Plans and Estimate Costs. So I can still help people, direct them to where they can look at what their options are once they have run an application. If they're a qualified health plan, you can either compare what the options are for different plans right within your account in the marketplace, or you can actually do that ahead of time. You can actually go to this button without actually running your application to see what plans are available in St. Lawrence County. And as part of that, there is a place where you can estimate what your tax credit would be at the end of the year, because that's in fact where your subsidy is coming from. It's just that the state of New York will pay it up front. You, at the end of the year, still have to claim it on your federal tax reform form and then reconcile. This calculator has been updated with beginning of this month, beginning of April. When you put in and try to estimate what your tax credit, it should now give you the correct value consistent with the bill that was just passed last month to show the increased value of your tax credit you should get at the end of the year to help with offset a insurance premium. When and how you can enroll, that has been changing because of the pandemic. For Medicaid Essential Plan, Child Health Plus, it has always been year-round. There has never been a open enrollment period that you may run into at a business, for instance, or employer-based insurance. And it used to also be true for the qualified health plans. But because of the pandemic, both at the federal level and now the state of New York, we have open enrollment to the end of the year. Even before the pandemic, if you were in what would be called a special enrollment period, you could have also applied immediately. Actually, basically 60 days of a change of your situation, your household situation. that would open up a special enrollment period where you could also go through the marketplace, even at the higher income where you're looking at a qualified health plan. But like I said, Medicaid, Child Health Plus, Essential Plan, it's always been year round. It still will be. The qualified health plans, most people that call me would have qualified in a special enrollment period anyway. They're retiring, they're losing a job, they're losing, employer-based insurance. Those already were special enrollment criteria. They could have also gone through the marketplace immediately, or at least within 60 days of that event. But now because of COVID, it's open enrollment for the rest of the year. So again, there's no reason not to do it. Again, costs you nothing. You're not automatically enrolled in a plan that's going to cost you dollars for a premium. You can see what your options are and then decide at that time whether or not you can afford it. So let's see here. So before I get to this, so I didn't have time, or I didn't add a specific, like I said, they just updated the calculator. So what the America Cares Act that just was signed, 2 weeks ago now, the dollar amounts have gone up. So let's say if someone listens to this that already has health insurance, has a qualified health plan through the marketplace, you should be getting a letter from the marketplace telling you that you now have a greater amount available to you. So at the end of the year, when you file your federal tax form, they're actually going to backdate it for the whole of 2021. You're actually going to get the higher tax credit for all 12 months. Again, it's designed to offset what you have paid for a qualified health plan. You can only get qualified health plans through the marketplace. The marketplace, again, the New York State marketplace, they again will now up that amount to that anticipated amount to help you defray that cost from day one, but only going forward. In other words, you've already paid January, February, March. The New York State is not going to reimburse you for any of what you've already paid, but they will, starting for May, up that amount, but you got to get in there and do it. In other words, if you're working with a navigator, give them a call. If you've done this on your own, you want to make sure you do it right. You can still call a navigator. You could always call the marketplace directly. But again, the letter, you should be getting a letter telling you what that new dollar amount is, but you do have to specifically get into your account and choose 100%, move the slider, go ahead and claim the full amount if in fact you want that full amount now versus waiting to the end of the year. Okay, the added amount of, so again, another aspect of the Affordable Care Act is, one, the formula they're using now to determine that credit is equivalent to saying that 10% of a household or your gross income is considered affordable for health insurance, which I never thought was legitimate, but now they've dropped that to 8.5% to redetermine that tax credit. It's also going to impact the top end. So people that in the past may have looked at the marketplace and still they found that they were full pay, let's say they're over that 400% of the federal poverty level. They didn't want to pay full pay for any insurance. They're going to find now there is a tax credit for them. So basically there is going to be a tax credit for higher earners. Not only then is it bigger for everybody above the 200 to 400% federal poverty level, above 400, I don't know how high it goes. And the New York State of Health Marketplace is not ready yet as well. So they are promising that by June, they will now know what they can offer to people at the higher income levels in terms of what the credit should be at the end of the year. And then starting in June, the New York marketplace would be ready to pay again that credit up front to help make insurance affordable for people, even if they're closing in on the full pay premium costs. if now with the passing of the America Cares Act, there's going to be some help for them. There is going to be a tax credit at the end of the year. Starting in June, they will be able to get that paid up front by the marketplace. But as of right now and through till the middle of May. So basically the way the marketplace typically works is to get a policy in place for the beginning of the coming month. You have to get it done by the 15th of the preceding month. Again, because of the pandemic, they have relaxed that. People right now, let's say you're uninsured, you go through the marketplace. If you were Medicaid, you would find your Medicaid would start backdated to the 1st of April anyway. That's automatic. But because of the pandemic, we can always call and ask and say you have extenuating circumstances, whatever. You've got some outstanding bills. You can always ask to see if you can get that start date backdated to the beginning of this month, even for, again, the qualified health plans. So I believe by beginning of May, hopefully the marketplace will be ready. Actually, I'm not sure. I'm thinking, well, I don't know. I really not totally sure when the marketplace is going to be ready for higher wage earners to see what kind of tax credit they now may be able to get starting in June. I would hope by the middle of May, but don't hold me to that. All righty, so let's see here. So again, this slide here is already outdated because the health emergency they've continued to extend that out. Again, the open enrollment period has been extended now for the rest of this year. No, I take it back. This is current for that. It is extended through the end of 2020. And also independent of the marketplace, hopefully people are aware, for instance, here in the Potsdam area, we have, the state-sponsored vaccination center at SUNY Potsdam. Yes, if you have health insurance, they're going to want to bill your health insurance to pay for the vaccinations. But if you go in there without health insurance, you will get vaccinated at no cost. So again, because of the pandemic, there is no reason anybody cannot get the vaccination. In terms of testing, the COVID test, that I'm not quite clear. I know there are some people that had to get multiple testing twice a week or something, depending on maybe a job. Actually, I do not know coverage of that by way of what their insurance is going to do, or for that matter, if they are uninsured, what kind of help you can get with that kind of coverage. That if people have a question about that, I'm going to have to look that one up. I just thought of that question myself as I was talking. But like I said, I think I got something for everybody. If you're uninsured, you should be giving me a call. If you've lost a job, even before the pandemic, you could have found out what your insurance you could have got through the marketplace. Again, if you got kids, you definitely need to find out, what the options are to get your kids covered, even if you think you still can't afford it for yourself. But I think you can find, you may be surprised, and in fact, even for yourself. So again, these dates are obsolete. They have now extended the open enrollment to the end of the year. And even if we don't beat the 15th of the previous month, if you have some outstanding bills, you have some medical tests staring you in the face and you need medical coverage, you can always get enrolled in an insurance plan, give them a call and say, I need my start date for this insurance moved up a month. There's always a possibility, and the likelihood of them saying yes has gone up because of the pandemic. So I'm wrapping up here. So I am what is called a navigator. There are other people that don't have quite as much. There are other assisters that basically can help you do your own application looking over your shoulder. But as a navigator, I can work with people now over the phone because of the pandemic, whereas before we would work with you face to face. As far as I know, that's not going to change. People can call the marketplace directly, and that's that customer service center, and people there can work with you much like I would as a navigator. They would run your application as you talk to them over the phone. They will not have specific information about insurance plans in St. Lawrence County. For instance, they will not automatically know that St. Lawrence Health System does not take Fidelis metal plans. Those qualified health plans, not only are these companies negotiating with the state of New York to get their qualified, so again, these are the higher income people. To get those health plans on the marketplace, they have to go negotiate with the state, but they also are still negotiating with the providers to create their own network. And that's why the premium payments are not going to be the same between companies. St. Lawrence Health System does not take Fidelis. If you called the marketplace, they're not going to know that. If you're in Lewis County or Franklin County, I actually still need to go up that learning curve myself to find out what the plans are available there, and if your hospitals, are there any plans you have to avoid if your doctor will not take that plan. So that's something the marketplace is not going to be able to help you with. But let's say you need help with language. Yes, then again, you can call the marketplace to get language assistance. There actually is a way for a navigator also to call in and to get help with translation services to work with people as well. There is the generic New York State of Health website. That was actually, here's the URL for the page I showed earlier. We don't need that. So of course you can always go directly to the marketplace for more information. I have these sheets that we used to hand out, hard copy. I have digital copies. I can send people these, or again, you could get them directly from the state. Of course, all language. Yeah, go ahead, William.
Oh, I was going to say, any of these materials that people want to have access to, that you say you can get them to them. You could even have them do it through the library if necessary. At the end of this, if you want to put your email in the chat for Audrey, who is with us, and then I can also share that into the comments section of the Facebook live stream. And then I will add it later to a post that will make it available to people so they can contact you for these materials. And then if you want to have those resources available to me here as well, I can then also be an outlet for anyone that needs them.
And here, in fact, is that information.
Oh.
So again, calling directly to New York State is the 1-855 number. That's the marketplace directly. I'm here at Health Initiative, and here is my cell number, 315-261-2338, and the email is here as well, and I will put that in the chat here before we wrap that up as well. So let me stop the share. I'll put in that email and open it up. Gosh, I used more time than I thought I would, but any questions, Audrey?
So I work as a health home care coordinator, and I was basically attending to be able to find out some information from one of my clients, or to be able to direct one of my clients to find out some information regarding getting health insurance. He works full time, and his employer does offer health insurance, but he stated that the health insurance is too expensive, and he was looking to see if he's eligible for other options. And it's just health insurance for himself. So he's probably somebody I would refer to a navigator to be able to look into things that he may be eligible for.
Yes, and that, like I said, so just last month, they dropped that criteria for, so yes, if he could get affordable health insurance through his employer, he's supposed to do that. They now dropped that though to 8.5% of his gross annual income. And so it's more likely now than even before that it is unaffordable. And yes, then he can go through the marketplace. Or there's also when people like start a new job and they have to wait, they're not eligible. They have to wait for some kind of open enrollment period. That would be it's not available. They can go through the marketplace. Okay.
So David, the other question that I had, we're talking about folks who are getting their tax credit. And the tax credits, for example, if somebody already has a plan and through the marketplace, and they have a change in their tax credit because of the recent American CARES Act that was signed on March 11th. They make a call to the marketplace. They make the change in their plan to get to really benefit for the tax credit, the larger tax credit they get. How does that change their tax filings at the end of the year? So, like if they're looking at 2021 and say, for example, it's because it's changing mid-year, how does that change their?
Okay, well, a couple important things that give me a chance here to emphasize. They should be getting a letter that will tell them how much more the credit is available to them. They though need to get into their account. So either they already know how to access their own account, or they can call the marketplace. They can, if they've already working with a navigator, just call that same navigator, or you can always choose a new navigator if they need to do that to help them. An important thing to remember here is you do not have to rerun the account. They don't have to click a little button that says update application. And that's maybe a good reason to work with a navigator is you can go, they'll know how, I know how to go directly to the plan page where you just go through and find where we can adjust and take that full credit. At the end of the year, the answer to the rest of the question, that's the same as it always was. So at the end of the year, they're going, as in their account, they will get, it's called a 1095A. It'll be a statement from the marketplace that will specify how much money the New York State has paid on their behalf to an insurance company. That has then the information they need. Also, it has then what the insurance policy costs. So it'll also have how much that person paid. So in other words, on your federal tax form, you're not going to get more credit than what you have paid for health insurance. You can't make money on this. It is, a subsidy to help defer the cost of a health insurance plan. When it comes time to file your 2021, the new formulas are already going to be in place. It's backdated to the beginning of the year. You're going to get the new increased value for the whole year. The state of New York is only going to start helping you with more money to the up to 100% of that credit starting in May. So at the end of the year, you may actually have more credit due you than you realize, what you've already overpaid, so to speak, for January, February, March. But the process is exactly the same. There's a special form that people have to file with their federal tax form. It's the same form that everybody around the country has to use to claim the credit. In New York State, then you use the information from the 1095A to also reconcile with what the state has paid on your behalf. In the past, before what's happened here in this year, this crazy year we're living through now, what am I saying, going on 2 years, right? Or definitely over a year now. The amount would, if people took 100% of the anticipated credit at the end of the year, they found that their income is exactly what they told the state it would be, they would break even. The state has already paid exactly what their credit from the feds. So the money doesn't come to them, it's going to go back to the state because the state has already paid it on their behalf. This time around, take your 100% going forward at the end of the year, though, you still should, when you file that and reconcile with what the state has already paid for you, there's those 3 months where you've actually now paid a little bit more. So there's probably should be some additional credit due you at the end of the year. But there is a form that people are required to file with their federal taxes to claim the credit. And if you don't do it, you're not going to get an additional, they actually call it the advanced premium tax credit when you go through the marketplace because the state is paying it in advance. If you don't reconcile for the year before, you're not going to be able to get it for the coming year. And again, these qualified health plans they run on a calendar year. Actually, I'm glad I forgot to mention that. So another distinction between these plans and Medicaid, Child Health Plus Essential Plan, when you enroll in those any time of the year, they run for a 12-month period. From when you started, after a year, you have to renew. Other than in times of pandemics when those plans have been auto-extended. In normal times, again, they run 12 years. You would be asked to update your application and requalify. Qualified health plans run on the calendar year. So even though you're, let's say you're looking to enroll a plan now that would start, let's say, well, right now, give the marketplace a call, get it to start April 1st. If you want to pay the premium for April 1st, you got some expenses coming up, you got to go into the doctor or something. Asked to have an April 1st, got to pay the premium, but that plan still will end at the end of December. And you will need to update an application, reapply, choose it, make a different choice, choose a plan January 1 for next year. Yeah, I hope I got the question plus a little extra.
Always, you're very thorough. I can tell anybody that's following with us, and Audrey included, that you and I worked together when I was doing health insurance stuff, and always it was helpful. I've called the marketplace and talked to people there, and have interactions with them. So it's been an extremely useful tool. Everybody's been very handy and helpful. And patient, because of course, this for anyone who's unfamiliar with it. We talked about it before. It's you can ask questions, but there's always a lot of questions, especially if you're unfamiliar with the insurance, the industry of it, the application for it, what's available, what's not, and how it works.
All right, just read your comment.
No, it's great. So, this has been great and very helpful. And, I don't know if the only things that I could think to add at the end, I just wanted to reiterate was that, you're not a health insurance provider. So for folks that are watching this, and have been sitting through this, I want them to remember that you're somebody who is there to help them, not try to sell them insurance. So it's really, you've been someone who's filled with information, someone who's been able to, help along the way. Without trying to convince them that they need it, but just really to find out what's affordable for them if they want it, and that it's free. To talk to you, to apply, to find out what's available to them, it's all free.
All free.
And additionally, that if anyone has questions for you, I put it in the comments section for our Facebook page, and I'll add to that again later. Your email address that they can contact you that way if they have any follow-up questions. And I will then add any additional information. You and I can contact and talk after, and I will, write a little bit more of a fuller blog to go with this video for a later date for anybody that was unable to watch. That'll give them a little more concise information, and with contact information and stuff where they can go and find some of the things they may have seen here today, and some of the updated information as well.
Very good.
Anything else, David?
Nope, I think, I can't think of anything.
Great. Well, listen, thank you so much. And, we will, we'll follow up, and we're going to be working on doing programs together in the future. So I look forward to doing those with you as well.
All righty, you too, William. You have a good rest of your day.
You too. Bye now.